Welcome to the Fitnatics. Today I'm joined with Stephanie and Liz from Restore. Good morning, ladies. How are you?
Morning.
Good morning. We are doing great. How are you?
I'm fantastic. I'm so excited to learn all about what you guys have at Restore. So let's get started. If you could just tell us a little bit about yourselves and your background.
Okay. So I'm Stephanie. I've been with Restore now going on 3 years. Prior to Restore, I was with Gold's Gym for about 13 years. So I've always been into health and wellness. I feel like I love to kind of serve and pay it forward and help people feel their very best. So that's why I love, working here at Restore.
Excellent. Thank you.
And I'm Liz. I'm a registered nurse here. My background is mostly in surgery, pre-op, and post-surgical recovery. I've been at Restore for just a little over a year now, and I was just kind of wanting to make a transition out of typical healthcare and into something more alternative.
All right. Very cool. Okay, ladies. So tell us about Restore for those who don't know. What is Restore? Where is Restore? Tell us.
Well, we do it all here. So we have everything from cryotherapy to IV drip therapy, but we cater to everybody, whether it's an 8-year-old athlete to NBA players to, all people of all ages, whether they're looking for immunity, whether they're looking for athletic recovery, pain management, wound healing. We do it all. We even provide beauty services. So we do have an esthetician here on the team, and we also do hydra facials, cryo skin, on top of the nursing services, and of course our core services like the cryotherapy and compression and so forth.
Excellent. Now, my biggest question, I have a client who really turned me on to this. Had no clue part of this. So let's dig into it. Tell us about the NAD plus IV therapy. What is it? Who is it for?
Yeah, so NAD is naturally occurring in our bodies, in all of our cells, in the mitochondria of all of our cells. Mitochondria is responsible for producing ATP, which is the energy that our body uses for all vital functions, as well as like that get up and go energy. NAD is something that naturally decreases as we age, which can be responsible, of course, for like lower energy levels, slower healing, slower metabolism, all of that. Additionally, as our bodies are taking on environmental damage all the time, we're stressed, we're not sleeping enough, maybe we're not eating right, we're drinking alcohol, whatever the case is, we're constantly taking on damage to those cells. And that's just decreasing that NAD further. So we can see, just feeling sluggish. And a lot of people come in, they're like, I just want to feel better. So we do NAD, and it's an infusion. It basically is purging your system of these old damaged cells and flooding your system with new NAD and making your body create new NAD to get these higher levels. So much benefit to it. We see, decreased inflammation, decreased pain, better sleep, decreased stress, decreased brain fog, the increased metabolism, energy level. So amazing all around.
So tell me, Liz, who's the ideal client for NAD?
So basically anybody. I mean, depending on your goals. Usually, I will say people in their 30s and beyond, just because we are taking on a lot more damage at that point in our lives, and because as we age, that's naturally decreasing. However, we do have some younger people that come in that are trying to reach fitness goals, reach those PRs, whatever it is, and just give themselves that extra boost. So, really and truly, depending on your specific needs, I mean, we can definitely tailor it to just about anybody. Oh,
Okay. Got it. Got it. In that case, how long does it take to see the benefits or to feel the benefits of an NAD treatment?
yeah. So, actually, we do start with the loading dose. So, you come in for 4 days in a row to start your loading dose and do your drip for those 4 days. However, people usually say just after that first drip, they start to see a difference. The first thing people say is usually they get better sleep that night. I believe your client that you spoke of earlier said everything seems like it's in high def after her first trip.
Right.
So they're almost immediate.
Excellent, excellent. So, and I initially had said NAD plus. Is there a difference between NAD and NAD plus
No,
IV therapy?
no,
Okay.
that's what we call it. Yeah.
Okay, got it, got it. So with the NAD, what type of any research, scientific research supports some of this data, some of this, outcomes, if any?
Absolutely. So there is so much information out there, so much research. And when I do have somebody come to me that's interested in it, I kind of give them the rundown and then I'm like, Google it. There truly is so much information out there to really kind of understand and know what you're getting into. Because obviously there is like this biology level to it. And, you know, to make it digestible for people. Sometimes it's nice to be able to just do a quick Google search and get all of your questions answered that way. Um, but really and truly, this started in like the 70s, I believe, and they started using it for people in drug and alcohol rehab. And it was very successful in helping people with addiction because it's kind of doing a overhaul on your whole DNA system, basically. After that, people are realizing there's actually so much more benefit to it. And so it's been used in the alternative wellness to just make people feel better.
Wow. So then, and correct me if I'm wrong, because this is all kind of new for me. Is it more like an overall detox for your body and brain?
Absolutely. Yeah. Yeah. It's like a cellular reset.
A cellular reset. Very cool. Where does the NAD come from?
Yeah. So ours is obviously synthetic. It is produced synthetically. However, it is naturally occurring in the body. So the body can't tell the difference, essentially. So then it can use it for all of our bodily functions, vital functions that we need it for.
Excellent. Got it. Got it. Now, Stephanie, tell us about. I don't recall if you mentioned it early on, but I know in speaking to you previously, you mentioned something about a hyperbaric chamber. Tell us about it, please.
Yeah, well, Liz will be the pro because it's a nursing service, so I'm going to leave those questions to Lizzie. But we do have hyperbaric oxygen therapy, and Liz can definitely talk on that.
Yeah, so ours is not medical grade, but hyperbaric originally started in the hospital to help with wound healing, is what it was originally started for. And I mean, oxygen is medicine. What we do is we're putting you in this chamber, it's pressurized chamber. And so the oxygen is not only going into the blood cells themselves, but blood products. So you're getting highly oxygenated blood all through your body, and it helps with accelerated healing, muscle recovery, any soft tissue injuries. We see a lot of athletes come in here just to help recover muscles. It's also been really amazing post COVID, helping that like post COVID brain fog. Great at regulating sleep cycles and helping de-stress, and it's relaxing. You go in there and just lay down and nap for an hour essentially. So it's very approachable and people have amazing results.
Awesome. So it's about an hour that you stay in the chamber.
Correct.
And how often, how frequent do you
So
recommend?
you can definitely do it as much as you want. I know some like professional athletes actually just like sleep in these just because it's so good for you. We do recommend doing like a 10-day loading dose. So coming in once a day for 10 days. And then after that, just kind of coming back for like a maintenance treatment if you're starting to kind of feel run down, that type of thing.
Okay, awesome. Very, very cool. Okay, so another question is I've had some other clients, to include my husband, um, dealing with allergies. What do you guys have, if anything, that can help with these allergies here?
Yeah, absolutely. We have a lot of IV drips and our shots that can definitely help with allergy symptoms. Magnesium is one of the great things we love. It is a natural smooth muscle relaxer. So all of those like inflamed tissues and that type of thing, it's going to help calm those down, help those allergy symptoms. All of these immunity boosters, vitamin D, vitamin C. Vitamin C is another natural anti-inflammatory. So that one's great for allergies. And then our vitamin D, of course, is going to be boosting immunity, helping with some of those allergy symptoms as well.
Now, I will say, you have a client who does NAD who has said she does her NAD because she no longer has to take her allergy meds in the morning. Like NAD has completely like helped her with that. So it's really cool.
Wow. Wow. Thanks for sharing that, Stephanie. Good to know. Very good. Um, Another concern that a lot of my patients, or excuse me, my clients have at times is pain management. Flare ups, whether because it's of immune systems going on, something going on with that, or an injury. What can Restore provide for pain management?
Well, we'd love for them to come in. They can go to any restore and kind of do an assessment and talk about the pain and where, how it happened, whether it's an injury and so forth. But we do have, compression therapy that's going to help with any lactic acid buildup, range of motion, recovery. A quick one's definitely cryotherapy. If you guys have not done cryo, go try it. We have an Arctic system here, so it goes to about negative 240. So it's a modern day ice bath. So people come out and they're able to tie their shoes at eat, with no problem. So it's really cool. And then your body is definitely going to warm itself back up. So it helps with your metabolism as well. If you're looking for, that metabolism boost as well. And we have red light therapy. Red light therapy is going to help with inflammation, pain management, skin health, energy, sleep. That's a 10-minute session. And then we also even have a sauna. So our sauna is an infrared sauna. It has chromotherapy, so it has different lights in there. So it's not your typical gym sauna. And that's going to help with the detox and then pain, of course, if that's something that, a client is looking for. But we love to do an assessment. Again, we even have a lot of people have targeted areas. So we'll do like a
Mhm.
local cryotherapy session in that particular area. If it's like an elbow or an ankle or an Achilles, we get a lot of those. So that's going to be a 5 to 10 minute session in that particular area just to get them back up and going.
Very good to know because when I think of cryotherapy, I'm thinking, everything from the neck down, right? Going into that chamber and just preparing, embracing myself. So, what you're saying is that you guys have the capability to target certain areas of the body without having to go full blown into that cryo chamber.
Yeah. Yes.
Ah,
And
very.
just so you know, it has different levels. So if someone's like just, very apprehensive to try, we'll start at a beginner level. We won't, do the full 3 minutes. We'll do like a minute and a half to two and kind of work, we'll work your way up. But we play music in there. We're with you every step of the way. So it's not like we just leave you. We kind of like cheer you on as you like go through it. So it's cool.
Of course, it's an experience, right?
Absolutely.
Now tell me, ladies, which is the most popular service that everyone comes in that you're like, you've got to try this?
Definitely nursing.
Oh.
I mean, our kill it here. I had a client who hadn't been in like 5 days, and yesterday she's like, "Oh, I really missed this." So it's definitely the IV drip therapy. I get a lot of clients who it is different if you're taking vitamins orally versus having an IV through the vein. So nursing is definitely our most popular service, whether it's a quick shot or someone needs an energy boost or they're in pain and they need Toradol. I feel like the nurses really come up with a concoction to get that client feeling like they're very best because they go over like, well, what are you feeling, what are you wanting to feel? So we customize everything based on the client, so it's really catered to them.
Wow. Okay. So that's great to know, Stephanie, because so it's not like pick group A or B. It's basically what's going on. Okay, this is very, very good. So
Yeah.
every time it could be different, obviously, right? Depending on the client, depending on what they're going through. So there's not just a standardized plan A, plan B, etc.
We have that. We have a menu where it has our most popular, but people will sub something out because they have migraine, so they'll add magnesium and take something out. So it's custom. You can customize it.
Wow. Okay. Very, very cool. So tell me what's going on in November with the store. Are there any specials? Are there any deals that we can get in November with you guys?
Yeah.
Yeah, absolutely. I'll have Lizzie. Well, we will be celebrating, Black Friday. I don't know the deals yet, but we're going to have some great promotions for the month of October. If you sign up for a membership, you do get double the credit. So it's a great way to try everything out for one price. And in November, we're actually launching something super special, and I'll have Liz speak on that because it is a nursing service, and I'm excited.
Yeah. So for November is prior to now, we've always just done the NAD infusions, the IVs, but starting in November, we will be offering NAD shots. So it is a once weekly shot for 4 weeks, and it is paired with a cryo session. You get that included. So it's kind of like a mini detox, whereas your IV, you're coming in for the 4 days. Sometimes the drips can take a couple of hours. These shots are going to be pretty quick. You're still going to get a lot of benefit from them. And it's a great option for people who are a little bit hesitant to do the IV drips. And this is like a great starting point to just kind of get an idea of what it is and how you feel. And also with our NAD for our Cyber Monday, I guess, Cyber Week deals, we will be offering 20% off NAD packages as well.
All right. So not just the shots, but the whole full blown NAD.
Yeah.
Yeah. Very cool. And that's going to be for the Cyber Monday, Black Friday special.
Correct.
Yes.
Excellent. Very, very cool. All right. Now tell us, because I've got clients all over the US. So you guys are not just located in San Antonio, correct? Where else are you guys located?
We are located in about every state. We're currently at about 160 stores and growing rapidly. We have 2 in San Antonio. They're opening up 2 more. So that's, coming soon, but we're all over. So if your clients are in different states, have them Google, they can totally find a restore and they'll be in great hands.
Awesome. I believe that 100%. You guys have been fantastic. What are the hours? What are the hours that you guys are opening typically?
So Monday through Friday, we are open 10 a.m. to 7 p.m., Saturdays 9 to 5, and Sundays 10 to 5. So
Okay, great.
yep. Yeah, weekends are pretty busy. They're pretty, yeah. We get really busy Thursday through Sunday. I feel like everyone's like gearing up for the weekend and the start of the week. So it's great.
Stephanie, is it do we need to call and reserve, or is that something we can just go in and get services? How does that work?
Yeah, walk-ins are always welcome. If you're someone that you need to be out by a certain time, I definitely recommend call us, make an appointment so you're on the schedule, especially if it's the first time IV drip. So our nurse has all of the information, to get your health stuff going. But walk-ins are definitely welcome. If you just want to pop in and do a tour and kind of then make an appointment, we totally encourage that as well.
Okay, very good. Now, something I didn't address earlier, but came to my mind because I'm thinking about myself here and my clients is we're getting into that perimenopause, menopause stage. Which services do you guys recommend for some of those symptoms that we may experience going through that process?
Yeah, I mean, definitely the IVs. That's a big, definitely kind of mix and match to help with some of the symptom management. Mix and match our ingredients, of course, to help give people relief with those symptoms.
I mean, cryotherapy for sure. Also, hot flashes. So yes, cryotherapy is a popular one, but I would say definitely IV drip therapy, cryo. And I mean, a hydrofacial is gonna have you feeling glowing and feeling amazing. You're gonna feel great. So I would recommend a hydrofacial with Milan.
Tell me about it. What is that exactly? What happens?
So with the hydrofacial,
Mm-hmm.
okay, and it has different beauty services. So we always recommend doing just a consultation. She has 3 different kinds of facials: a hydrofacial, a cryoskin facial, and an oxygen facial. So depending on your skin, she'll do an assessment and then kind of recommend. But our hydrofacial is definitely our most popular, and that's basically going to extract all of everything from your skin, like blackheads, whiteheads, all the gunk, and it puts it in a jar. So after your facial, you get to see everything that was extracted. It's like a gunk jar. It's mind blowing.
Oh
Like
my gosh. Okay.
it left feeling just like amazing. Like no pores, no blackheads. Like just amazing. So I always encourage people to do that, especially right before the holidays.
Perfect. Perfect. Thanks, Stephanie. Now, last question for you both is, are you a fitnatic? And I'm sure you are because you're in this health and wellness field. And what do you guys do to stay fit and healthy?
Yeah, absolutely. So I Peloton for sure. Like I love my Peloton app. So I do that every morning before work. And I do my cryotherapy, and I have Liz give me shots as well. So I always have energy to stay up and going. But for sure it's so important at least to average like 12,000 steps and above a day.
Wonderful. Thanks, Stephanie. Liz?
Yes, I'm a yoga girl. That is what I love. I always tell people I'm 87% vegan. I'm a lazy vegan. I still eat eggs and occasionally seafood, but definitely a clean eater. I'm a yoga and NAD. I love NAD.
Awesome. Stephanie, have you done the NAD treatment?
Yeah, we actually both have, we do it together. Our owner actually was like, I need you guys to try it, like experience it. So we did it back in April. So we're doing our maintenance doses, and we usually do that together. But yes, absolutely. And Lizzie monitors all my results. So one of the biggest ones is, my heart rate and my sleeping patterns for sure. But I love NAD. I feel like everyone's experience is different. So it's always really interesting to see how NAD has helped, me versus Liz versus our clients.
Exactly. Well, whatever you guys are doing, continue doing. You all look phenomenal.
You
Phenomenal,
do.
ladies. Thank you guys. I really appreciate your time and attention today with the Fitnatics. And for everyone else, thank you for joining the Fitnatics. We'll see you next time.